Well, hello, PaleoFX tribe. It seems like I was just here. In fact, I was just here talking to Gasku just a few minutes ago with my good friend Brian Bradley. But right now, I have Dr. Matt Dawson. Dr. Matt Dawson is the CEO and co-founder of Wild Health, which is a super, super, super interesting program that I am very, very stoked about because this type of medicine practice has only been accessible to those who, let's just face it, were wealthy, right? Had a lot of means to be able to access this type of information, these types of forward-thinking doctors. Dr. Davis has found or Dawson, I'm sorry. It's been a long day. It's been a long coffeeless day so far. Dr. Dawson has found a way to present this type of medicine to the average guy, the average Joe. And Matt, we had talked about before that neither of us came from, how can we say, we had rough and scrabble upbringings. And so I love the fact that you are making this type of medicine accessible to people who are, the average Joe and Jane out there.
Yeah, I grew up in rural Kentucky, poor, super happy, blessed with the best parents and best family in the world, but didn't have much when it came to money at all. And so that did bother me when we first got into the space, doing genomics-based precision medicine, to sequence someone's DNA, to take the time to corroborate that and correlate it with their lab work, microbiome, all the testing, all the physician time. It was just expensive. It just took a lot of time and a lot of resources, and it was incredibly fun. It was really powerful. We were getting great results, but I didn't like the fact that people where I'm from couldn't afford it. So we very quickly, early on with Wild Health, we started trying to figure out how to democratize it and how to do it less expensively. So what we did is we invested a lot of time and money and resources in building some algorithms, making it a little more automated. When we first started, my partner Mike and I, we got into this several years ago, it would take us 10 hours to go through someone's genetics, the lab work, the microbiome, the patient preference, talking to them. And that's expensive to take that much of a physician's time and do all the testing. But what we've done is we got some really great data scientists, some people that had worked with big companies before, and we got them to build algorithms with us. And now we upload the genetics, we upload the lab work, upload the microbiome, upload patient preference, and we get spit out these precision recommendations and the time savings. And then we've also negotiated with some of our labs and genetic partners, and we've got it down to where someone can afford to do this and have precision medicine now.
And what I love about what you guys do is you look at the body as a whole and not this kind of the old Western medicine model of the body being a conglomerate of different glom-on parts. Right?
Yeah, we think it's a major mistake. When a patient comes to us and says, I've got migraines, that's my problem. In medicine, normally we just think about the brain. That's a mistake. When someone has a heart problem, we just think about the heart, but it's a system as a whole. And what we found is when you try to optimize the entire system, then those individual problems frequently just get better. If they don't, then you can really dive in. But to not optimize the system, when someone has a migraine, if you don't optimize their sleep and their diet and their exercise, then you're probably not going to solve the problem. People have been conditioned to want a pill to solve a problem. That's not what people actually want, but that's what we gave them for so long in medicine, that's what they expect. So you have to wrap people's mind around the fact that we have to not focus on the body or the mind or one system. We have to focus on the entire thing if we really want to get to optimal health.
Right. And I always wondered, prior, why medicine did not adopt some principles of engineering, namely the idea of system complexity and whole systems and systems thinking and root cause analysis and all of this type of thinking that you are doing now, but it's not common right now in Western medicine. It's still very reductionist.
It is. I think there's several reasons for that, and your guess would be as good as mine. But when I look at it, first off, that's hard. So that's difficult to do. Secondly, that there are obviously maybe some conspiracy theories around medical education and who controls it and the pharmaceutical company and all that. How much that plays into it, I don't know. I'm sure there's something there. And then also I think just in America in general, we have kind of the industrialization of things, division of labor, and that kind of went into medicine where instead of having a doctor focus on a patient, we have a neurologist and a cardiologist and an endocrinologist and an OBGYN and a sports medicine doctor and an orthopedist. So I think that division of labor, us knowing that being specialized, you have to get pretty specialized to be able to do neurosurgery. Your general practitioner can't do that. But we've taken that too far, and then it's really discounted the power of looking at it in a systems way, like in the engineering example you gave.
Right. I think that I don't know if you saw the interview that I did with Mario Martinez. It was last week. I think you would be very, very interested in his take as well. There's an emergency call.
Sorry, one second.
Absolutely.
Hello.
So just to catch you guys up, Matthew is right now in working the emergency room in. Are you in Lexington right now?
I'm outside of Lexington. So I trained as an emergency medicine doctor, and I got to where I wasn't doing anymore. I would do 1 to 2 shifts a month, just because I enjoyed it. But with I don't know if you've heard about it, but there's a global pandemic going on.
Really? Wow.
And news flash for everybody. With that, there's a couple places that I would help out who they can't staff. And instead of 1 shift, I'm doing 20 this month. And I got called in today, so I'm here. So I apologize for that. But when a pandemic strikes, things change a little bit.
No, what God bless you for doing that. First of all, thank you very much for your time. And from one prior first responder in the military myself, I know how much it takes away from family and just your life to be able to do that. So thank you very much for doing that. Mm-hmm. And this might be a great segue to ask, in as much as you feel compelled or willing to tell, like what do the front lines look like right now? And the people you see, what are the underlying comorbidities coming in, and how is that affecting patient outcome?
Yeah. So about a month ago, I realized how bad this was when one night my phone started blowing up from several patients of mine. They were actually pro athletes, and some of their teammates had tested positive. And then I also got an email from a friend on the front lines, and I read the email. I was sure it was either in Italy or China, and I called him the next day, and he said, no, this is in Washington State, 2 hours from me. And since then, I have really good friends, close contacts in Italy, Sweden, New York, all around. I've been talking to the friends in New York constantly, and it's really bad there. Where I am, it's not as bad. It's scary when we intubate patients or have critical patients. We're putting ourselves at risk, but it's not like it is in New York. Things are pretty bad on the front lines there. In fact, with Wild Health, we've completely, in the last month, we have about 40 MDs and PhDs, and we've completely shifted our focus from genomics. We'll get back there, but focused on COVID-19. We're doing daily updates on our Wild Health podcast on it, and we have our own biotech lab. So we're doing our own testing. We have coronavirus testing, also the serology testing that we're doing, the antibody testing for our patients. And we've engaged with several pro sports leagues and others to talk about return to work and return to play. So honestly, we're living and breathing this right now, and this is our focus instead of the genomics. We'll get back to the genomics, but it's completely overwhelmed us and changed our focus for sure for the short term.
And I think it's just bizarre to me or wild. Obviously, I'm not in a medical facility, but here in Austin, which is already a very, very active city, when I go out, for instance, and ride my bike down to the UT campus to do sprints on the track, and there are just people everywhere. It's like nothing ever happened, right? But these are all healthy people already, right? And now they have time on their hands, and so they're, and it's beautiful out. You have healthy people with time on their hands, and it's beautiful out, so they're out exercising, and it's like two different realities. So I hear the other reality of what's going on with the medical professionals, but yet when I go out and do my thing, it's like it's a bizarro world. Do you understand what I'm saying? It's just two different realities.
Oh, 100%. I mean, I just driving in today. It's a 45-minute drive from where I live, and it's beautiful. It's spring. Nobody's on the road really here at least. And so it seems like it's just beautiful and everything is great. And then you get to the ER and it's not, especially in the places in the hot zones. And so I think it's a real problem, honestly, for people to wrap their heads around it,
Right.
because people are being asked to really make some sacrifices, and that's hard. We all want to be getting together and partying. The weather's nice, and you're not seeing what the people on the front lines are seeing, and it's really hard to make those sacrifices. And now we're seeing people protest and wanting governors to open back up, and I totally get it.
Mhm.
It's a really difficult thing to ask people to do, especially the fact that we've been doing a good job. Like the numbers are going down, it's working. And so I think that's leading some people to say we overreacted. But in the beginning, that's what we said. That's what we hope. We hope people say we
Mhm.
overreacted, because that means we did a good job and we did it well. So I would encourage people at least to just kind of hold the line a little
Right.
longer. I know I have good friends who, a good friend of mine in New York City who is pregnant and tested positive. I mean, we have healthcare workers that are dying, police officers and firefighters on the front lines that are dying from this. So we do need to hold the line a little bit longer.
Yeah, it's just so difficult for the average person, and I'd say myself, the average person, to get a full picture of what's going on, right? Because all you really know is what you experience firsthand, right? That's what your body really knows. And I'm not like you. I'm not on the front lines. My experience of this is just totally different than,
Mhm.
and I think that's very, very difficult just for a human being, right? To take in all this information and try to make sense of it, try to make it square. It's just very,
Yeah.
very difficult.
Well,
Uh,
and it's also so uneven, Keith. Like even on the front lines, it's completely different in Kentucky versus New York. So just the unevenness of it. We talk about what's going on in America, and that doesn't make sense to talk about it that way. We're such a diverse nation, so it's hard for people who aren't as heavily affected to stay home as well.
right, right. It's just totally, totally tough. Let's switch back the conversation back to wild health, and what does an intake look like for a client? So if I'm a new
Mhm.
client and I'm interested in this, what does an intake look like?
Sure. So we sequence everyone's DNA. We start there. We can use raw data from some of the companies that do it, but we've actually designed a custom chip to look at the SNPs that we really want to look at. So we sequence DNA. We think the DNA by itself is pretty much worthless. Like epigenetics are
Right.
much more important.
Mhm.
So we take those SNPs and we also see, okay, where are you at right now? Everything you've done your entire life, what you've eaten, what you've drank, your exercise, your stress levels have affected where your health is going to be today. So we have like that human operating system of the DNA, but then we do pretty extensive lab testing and blood work to get a picture of where you are now. We then need to combine that and layer on top what is probably most important, which is a long conversation. So it's an ancient tool we don't use in medicine very much anymore, but talking to the patient is critically important, because if we, for example, what's the perfect diet for you? If we find you have a PEMT polymorphism and you need more choline, or you have a FADS2 and you need more omega-3, well, also, what is your omega-3 level? Are you already taking care of that? And then will you eat fish or you hate fish? And we need a different way. So if we give you a perfect diet for you or a perfect exercise regimen, and you're not going to eat it, or you hate that exercise, you're not going to do it, we've wasted our time.
Right.
So it's a combination of DNA, lab work, microbiome, if you have it, and the conversation. And then that's a pretty long and detailed conversation at that point to come up with a full plan. Like, what should you be eating? What are your kryptonite foods? What are your superfoods?
Mhm.
What is the exercise regimen that's going to be sustainable for you, because it's important what you're going to do? What supplements may you need, not just based on genetics, but your lab tests and your goals as a person? What are we shooting for? And then when we move forward, we try to be very objective and data driven about, okay, what are our goals? You name what the goals are. We name what the targets are so that we know we're achieving those, and we have something to actually work towards, instead of just, hey, do this and then come back and let's talk later. We can be data driven in the approach.
And I always talk about this because I do a lot of habit change coaching, and it's goals and habits are one thing, but it's the systems in place that actually drive. Systems are measurable, systems are doable, systems are
Mhm.
all of these things that you can manipulate. And the goal or the habit is just kind of like the North Star.
Yeah.
You have to have a system in place, and it sounds like you guys do that. And also coming from the coaching side of things, I know that how do they say, even a mediocre plan followed religiously is better than the best plan followed not at all, right? So
100%.
how do you guys coach compliance with your clients?
Yeah, that's a great question. Yeah. I just gave a presentation yesterday to the horse industry. Protocols of return to race, and I said, look, all of this is a complete waste if you don't execute. It's all about the execution, and it's the same thing with our patients. So they get health coaches. So we have health coaches that actually will do routine calls for accountability, motivation, answering questions. Okay, we gave you a plan. What's the hardest part? What's the easiest part? And then we can brainstorm ways to adjust. And just the accountability is a big component. But then the problem solving, because they went through this with other patients before, tends to be really helpful. We don't require health coaching, but we really encourage it because it makes a big difference. When you require something, that's an extra financial burden. And so we're trying to keep the cost down low, but we really encourage the health coaching as well.
Right. And that's one thing I really picked up from Greg Glassman, the founder of CrossFit. But believe me, I'm not, Greg Glassman has his issues for sure. But the one thing he said that I agree 100% with was his analogy of the swim coach versus lifeguards. Right. And he said, right now, our medical system is a lifeguard driven system. Right. And and you can't expect, nor would you want, a lifeguard doctor to be the one continuously pulling people out of the pool. You have to have some swim coaches to keep them from drowning and take some of the pressure off of the lifeguards. And it should be a co-collaborative teamwork between the patient, health coach, and physician. And I think he was spot on in that assessment.
Yeah, that's a great analogy. Yesterday, I was working in Wild Health, and I was swim coaching all day. Today, I'm a lifeguard in the ER. Yeah, I love that analogy. That's great.
Yeah, but it really is, and I hope that our broader medical system changes that way sooner rather than later. But and people like you and Wild Health have picked up on that, and I would imagine that your success rate is pretty dang high when you have that kind of combination.
Yeah, we have data outcomes research, and we felt like what we were doing was working. We were surprised with how well it was working, for sure. And as we get more swim coaches, we should need less lifeguards.
Right.
That's a great goal, is to keep people out of the emergency department and the OR, for sure.
Right. And one of my very, very good friends, Doug McGuff, has worked many, many years in the emergency room. And I mean, it's just, to hear him tell it, it's frustrating for him, the people he sees in the emergency rooms and the number of people coming into the emergency room because of diseases of modernity versus what I would call a classic emergency, right? And he said those numbers are so far skewed, and it's frustrating for him.
Oh, the vast majority. And is Doug McGuff an ER doctor?
He is, yes. And
I had no idea.
Yeah, South Carolina, Spartanburg, I believe.
Oh. Yeah. Makes me feel bad about my physique as an ER doctor.
He's got it going on. Yeah.
Yeah.
Well, Matt, I could talk to you forever, but I know that you are busy working a shift. I don't know. It's got to be. I can't imagine you've had a whole lot of sleep in the last couple of days, and you're probably not going to get a whole lot more. So I certainly appreciate you coming on, taking some time out of your day, and again, thank you very much for everything you're doing.
Yeah, no problem. If people want to hear more, we have a podcast called Wild Health. We have daily updates right now. It's focused on COVID-19 and reviewing literature and research. Wildhealth.com is where, if anyone wanted to explore being a patient, they could do that. And then our goal right now that we're really focused on is training more of the lifeguards to become the swim coaches, to use your analogy. So we have a fellowship at wildhealthfellowship.com, and that's both for physicians and health coaches. Right now, the biggest need that we have is getting more people trained in this, because now that we have kind of democratized it, we need more providers. So anybody that's interested in that can check that out as well.
I'm telling you, Danielle, if you're still listening, check that out. This girl right here, Danielle Gordon, she would be a fabulous, fabulous health coach for you guys. She's spot on.
That's great.
Yeah. If she's not on, I'll tell her to check you guys out. You'd love to have her on board. And yes, so it's go to wildhealth.com and use referral code PaleoFX and check them out. Believe me, you'll be glad that you did. Matt, take care, brother. Thank you very much for your service, and I hope this this crisis blows over sooner rather than later, and you can get back to the work at Wild Health.
Me too. I really appreciate it. Thanks so much, Keith.
All right, brother. Take care, man. All right, gang. I will be back in a little bit talking with Tristan Truscott. That should be a very, very interesting interview as well. And I think that one's coming up in a half hour or so. So tune back in. And two, yes, really do think if you're in the health, if you're in the coaching business or anything like that, and you have an interest in becoming a health coach, I'm telling you, this is the new wave. If you can coach compliance, if you know health and wellness, you can coach habit change and compliance. This is what the industry needs. And those people, I'm telling you, going forward, that is going to be a key industry and a key position. And it is super, super needed because, as Dr. Dawson said, you can give people all the perfect tools, but if they can't implement them and if there's not compliance, it's kind of all for naught. So, it goes along with the idea that knowledge is not power. Knowledge is only potential. It's action is power. And so you have to put that knowledge into action to be able to actually do anything with it. And that includes changing your health and well-being. All right. I'm signing out for now. I'm going to go grab a cup of coffee and come back for that interview with Tristan Truscott of the Satori Method. I love Tristan, and you'll see why here in about a half hour or so when I chat with him. All right, guys. Peace out. See you guys very, very soon.